My name is Bryce Mander. I'm an assistant professor in the Department of Psychiatry and Human Behavior here at University of California. I am here with UCI Mindcast's next episode, Truth or Myth. Truth or myth? Poor sleep can increase risk for Alzheimer's disease. If you guessed truth, you're correct. A recent study published out of a group in the UK, about 8,000 people were followed, and it showed that those who slept less than 6 hours per night had an increased risk for dementia later on, roughly 30% increase. Now, this study is not an isolated study. There are a number of studies that showed similar findings in various forms of sleep disturbance. As a matter of fact, there was a meta-analysis of 18 longitudinal studies covering roughly 250,000 subjects that have been followed for roughly 10 years. The one caveat to this is that the mechanistic evidence linking why sleep disturbance increases dementia risk is less well known. There is some evidence in the literature, though it is relatively limited, that if you treat the sleep disorders, you may reduce the risk associated with them, such as treatment of sleep apnea. May delay the onset into dementia and reduce the risk for dementia. Less is known about insomnia or insufficient sleep duration per se, but studies are good. Here are a few tips to help improve your sleep. 1, make sure you get adequate amount of sleep. The recommended amount of sleep from the American Academy of Sleep Medicine is roughly 7 to 9 hours per night for young adults. Those over 65, 6.5 to 8 hours per night. Make sure that you go to bed and wake up at similar times during the day and every day across the week so that your schedules are regular and consistent. Make sure that your sleeping environment is cool, it is dark, it is quiet, and it is not stressful. You can have relaxing routines before you go to bed, and make sure not to engage in activating behaviors at night. Also, stay away from bright lights, especially green and blue lights in the middle of the night. So you can change your night lights to orange and red light so that it does not affect your rhythms. And lastly, if you have evidence of poor quality sleep or daytime dysfunction, or you think you might have a sleep disorder, seek help from a sleep medicine specialist. This is covered by insurance, and it is important to do this because it just might improve your quality of life, your mental health, and reduce the risk of dementia.